Little Malek was born at the beginning of March. His mother, Hind Sherghin, found out she was pregnant during the coronavirus pandemic. She was told to minimize trips to doctors or hospitals where services were stretched by the number of patients with the virus. Eventually, she fell sick and was diagnosed remotely with pneumonia. But after her illness, her doctor did an antigen test that confirmed she's had COVID-19.
It's just a huge, world that's really unknown, and it really pushed me over the edge, and I was so stressed out throughout the whole end of my pregnancy because of that. What if?
After several scans, Sherghin was assured her baby was developing normally, but she couldn't stop worrying.
You're kind of, playing a lottery with this information. I didn't get tested again for antigens, but I did carry out the fear with me and this worry and constant, second guessing everything I did.
Professor Asma Khalil, an obstetrician at St. George's Hospital in London, is among a group of doctors studying the impact of the virus on women and their pregnancies.
We included more than 6 million pregnant women from 40 studies from 17 countries. And we compared the pregnancy outcomes during the COVID-19 pandemic with the period before the pandemic.
The report, published in the Lancet Medical Journal, found that the number of stillbirths and the number of women who died during pregnancy rose by nearly a third during the pandemic. The number of women who needed emergency care for ectopic pregnancies, where the fetus is growing outside of the womb, was 6 times higher in 2020 than the year before. Also in the report, a significant increase in the number of women suffering stress and anxiety. Khalil says stillbirths and deaths are not a direct cause of infection from COVID-19, but from what she describes as collateral damage of the pandemic. Across the world, lockdowns prevented women from traveling to hospitals for checkups. Co-author of the Lancet report, Professor Shakila Thangaratinam from the University of Birmingham advises some caution over the data.
If you look at stillbirths, the figures are a bit more, but because of the rarity of the condition of stillbirths, the proportion itself is still quite low. We are talking about number of stillbirths around 1,000 in high-income settings and another 1,000 in a low-income setting. And again, this is something that will need to be reviewed constantly.
She says there is no doubt the pandemic has had an adverse influence on women's health, but many more studies need to be done.
How much it is, how generalizable this is across countries as well as across the income status. What are the specific factors that contribute most? So these are information that we still need to continue to report and collect.
Mariama Diallo, VOA News.